structure of bone. Gross anatomy of a long bone. Microscopic anatomy. Bone markings. Pages 137 to 140. Anatomy of a long bone. 3 major sections: diaphysis, proximal epiphysis, distal epiphysis. Anatomy of a long bone. Diaphysis, aka shaft, periosteum. Most of bone's length. Composed of compact bone. Periosteum. Covers the outside of the diaphysis. Fibrous connective tissue membrane. Provides insertion site for tendons and ligaments. Perforating, Sharpies, fibers secure periosteum to underlying bone. These are made up of thick bundles of collagen. Copyright 2015 Pearson Education Incorporated. Figure 5.3a The structure of a long bone, humerus of arm. Articular cartilage. Proximal epiphysis. Spongy bone. Epiphyseal line. Periosteum. Compact bone. Medullary cavity, lined by endosteum. Diaphysis. Distal epiphysis. A. Figure 5.3 See the structure of a long bone, humerus of arm. Endosteum. Yellow bone marrow. Compact bone. Periosteum. Perforating, Sharpies, fibers. Nutrient arteries. C. Anatomy of a long bone. Epiphysis. Articular cartilage. Ends of the bone. Composed mostly of spongy bone enclosed by thin layer of compact bone. Line versus plate depends on age. Articular cartilage. Covers the external surface of the epiphysis. Made of hyaline cartilage. Decreases friction at joint surfaces. Copyright 2015 Pearson Education Incorporated. Figure 5.3b The structure of a long bone, humerus of arm. Articular cartilage. Compact bone. Spongy bone. B. Anatomy of a long bone. Epiphyseal plate. Epiphyseal line. Flat plate of hyaline cartilage seen in young, growing bone. Causes lengthwise growth of a long bone. Think of a divergent plate boundary. Epiphyseal line. Remnant of the epiphyseal plate. Seen in adult bones. Copyright 2015 Pearson Education Incorporated. Figure 5.3a The structure of a long bone, humerus of arm. Articular cartilage. Proximal epiphysis. Spongy bone. Epiphyseal line. Periosteum. Compact bone. Medullary cavity, lined by endosteum. Diaphysis. Distal epiphysis. A. Anatomy of a long bone. Marrow, medullary, cavity. Cavity inside the shaft. Contains yellow marrow, mostly fat, in adults. Red marrow for blood cell formation in infants. Lined by the endosteum, thin connective tissue. In adults, red marrow is situated in cavities of spongy bone. In flat bones. In epiphyses of some long bones. Copyright 2015 Pearson Education Incorporated. Figure 5.3a The structure of a long bone, humerus of arm. Articular cartilage. Proximal epiphysis. Spongy bone. Epiphyseal line. Periosteum. Compact bone. Medullary cavity, lined by endosteum. Diaphysis. Distal epiphysis. A. Bone markings. Surface features of bones. Categories of bone markings. Attachment sites for muscles, tendons, and ligaments. Passages for nerves and blood vessels. Categories of bone markings. Projections or processes. Depressions or cavities. Copyright 2015 Pearson Education Incorporated. Table 5.1 Bone markings, 1 of 3. Table 5.1 Bone markings, 2 of 3. Table 5.1 Bone markings, 3 of 3. Microscopic anatomy of compact bone. Osteocytes, mature bone cells. Situated within cavities known as lacunae. Lacunae. Arranged in concentric rings called lamella. Lamella. Rings situated around the central, haversian, canal. Copyright 2015 Pearson Education Incorporated. Figure 5.4b Microscopic structure of compact bone. Lamella. Osteocyte. Canaliculus. Lacuna. Central. Haversian, canal. B. Microscopic anatomy of bone. Central, haversian, canal. Opening in the center of an osteon. Runs lengthwise through bone. Carries blood vessels and nerves. Osteon, haversian system. A unit of bone containing central canal and matrix rings. Copyright 2015 Pearson Education Incorporated. Figure 5.4a Microscopic structure of compact bone. Spongy bone. Perforating, Volkmann's, canal. Osteon, haversian system. Blood vessel continues into medullary cavity containing marrow. Lamella. Blood vessel. Compact bone. Central, haversian, canal. Perforating, Sharpey's, fibers. Periosteum. Periosteal blood vessel. A. Figure 5.4c Microscopic structure of compact bone. Osteon. Interstitial lamella. Lacuna. Central. Haversian, canal. C. Haversian system summary. From smallest to largest structure. 1. Osteocyte. 2. Lacunae. 3. Lamella. 4. Central, haversian, canal. 5. Osteon, haversian system. Microscopic anatomy of bone. Canaliculi. Tiny canals that radiate from the central, haversian, canal to the lacunae. A transport system that connects all bone cells to a nutrient supply. Perforating, Volkmann's, canal. Canal perpendicular to the central canal. Carries blood vessels and nerves. Copyright 2015 Pearson Education Incorporated. Figure 5.4b Microscopic structure of compact bone. Lamella. Osteocyte. Canaliculus. Lacuna. Central. Haversian, canal. B.